what symptoms should I call you about? Um, so the two main things that I would be concerned about, but are exceedingly rare, are going to be infection and retinal damage, retinal tears, and retinal detachment. We typically don't see this at all. You may go through a lifetime of doing intraocular surgeries and not see much of this. Retinal detachment is probably more common than an infection. But let's go through the symptoms of each of these. Everything else is not an emergency and can be addressed non-urgently. But these two are urgent cases where time is of the essence, and you'd want to be referred very quickly and to see a retina specialist. And it's the retina specialist that can help you in both these situations. So for a retinal detachment, typically it's preceded by symptoms of flashes and floaters. That's when the retina breaks or tears. The retina is it's a sensory structure. It's what interprets the light that's coming into your eye. So as it tears, it's giving signals to your brain that, something's happening. We're sensing this unusual thing, and it's giving your brain that in the form of flashes. Usually it's flashes. The retina typically tears on the periphery, so it's flashes out on the periphery. And usually it's a superior tear, so you're going to get flashes probably somewhere in the bottom of your vision, like so. Now, flashes, if you close your eyes and they go away, are usually optical, so it means that it's not your retina that's damaged. It's just, the light catching your lens in some way. So close your eyes. If you still see the flashing and it's pretty constant, then yes, absolutely give us a call. That we want to know that. We want to help you get to the retina specialist who can, help laser that off and prevent it from becoming a retinal detachment. A retinal tear, when the retina is damaged, will also give you the symptoms of floaters, and not just the usual floaters that you see, or a couple more extra floaters. These are going to be a lot more, like hundreds of floaters. And what these are is blood that's inside the eye or inside the vitreous cavity of the eye. The retina is a highly vascular structure. It's probably got the most blood flow of any of the tissues inside your body. So having a tear means that the blood is now, inside your eye, and then you're going to perceive that blood as new floaters. And so those two are, classic signs to look out for, that are very telling that there may be something wrong with your retina after surgery. Now, you can develop a retinal tear and detachment even without surgery, and sometimes surgery is not culpable. So some folks will have a retinal tear, many years after surgery, and just sometimes it's the eye aging and breaking down, or it's from injury, or it's hard to say why, but typically it happens with longer eyes. So if you were previously very nearsighted, you have a higher chance of having retinal tears and detachments. Let's see, and then infections, very rare, but the timeline of symptoms for infection would be, usually good vision for the day 1 after surgery, day 2 after surgery. Now on day 3, vision starts to get worse very quickly, like hour after hour, the vision gets worse. So that would be absolutely, definitely call if that's happening. And it's usually accompanied by the eyes red and very light sensitive, and painful. So with the light sensitivity, the eye feels pretty painful, like a dull ache. An infection usually is almost always all of the above symptoms. It's not just, the eye looks a little red. I'm scared I have an infection. No, it's usually all of the above. Vision getting worse very quickly, the eye looking red, light sensitivity, pain, and it all develops very quickly on usually day 3 to day 7, but usually day 3 after surgery. So if you have that constellation of symptoms, you'd want to give us a call immediately so we can get you to see a retina specialist. And what the retina specialist can do is to inject antibiotic immediately into the eye to kill off the bacteria, stop that process. But I would highly also encourage the retina specialist to, take the patient to surgery and remove the jelly in the back of the eye where some of the bacteria can hide, and just clean out everything inside the eye. A lot of my colleagues agree that a vitrectomy, cleaning out all the jelly inside the eye, is can improve the outcome after infection, so that you can have a higher chance of having normal 20/20 vision. Obviously, if you leave a retinal detachment or an infection for an extended period of time, let's say a day, 2 days, 3 days, the outcome is going to be worse and worse the longer you leave it. So you want to call if you have those severe symptoms as soon as you can, so we can get you rushed in to get them timely and appropriate care. Everything else, blurry vision, fluctuating vision, those symptoms, but just separate from each other, not the full constellation of those symptoms, is not concerning. And I would expect you to have, some blurry vision here and there, some light sensitivity here and there. The eye may look a little red and irritated here and there. Those are all very normal by themselves. But it's just the constellation and the severity of all of the above that and particularly on the time frame of day 3 to day 7, those would be more concerning, that there may be an infection process. So give us a call if things are just gut feelings, things don't feel right. Thank you.